So I think I'm your lunchtime entertainment. I don't have a PowerPoint. I don't have a picture. I have pictures for you. So since we are a smaller group, it'll be a little more intimate, and I'd love to have it as I get walking through this. I'd love to have a lot of more interaction, a little bit more give and take, because I'm as curious about you. I don't know if you're curious about me at all, but I'm learning a lot today. So as Matt said, I run an environmental policy center at U of L, the Center for Environmental Policy and Management. And the work of the CEPM centers around citizen engagement in environmental decision making. And we work with government officials and agencies and nonprofits, community groups, and really anybody who knocks on my door, picks up the phone and calls me, who wants to be a part of decision-making processes that impact and improve their environment. So it's a really broad mission, right? But the goal is to help folks make better decisions and empower them to figure out at what point can they do that, at what point, and what do they need to know in order to make good decisions. And so it's not just residents, but it's also policymakers who really need a lot of help in understanding what's going on out there as well. We also work to support a wide variety of community-engaged scholarship and research efforts. So there's a whole push in a lot of universities to do participatory action research, or have a robust engaged scholarship model, both in the hard sciences and the softer sciences and across the board, interdisciplinarity. There's also moves towards what's being called transdisciplinary research, where beyond the interdisciplinary kind of cooperation we've seen over the years, we also now are asking folks to bring in folks from outside of academia to engage and be full participants in the research models of all sorts. And that's really hard, and it's really messy, and it's really complicated, and people get really uncomfortable with it. And so one of the things that I want my center to be able to do as I grow and as I do my work is to help folks navigate that messy world. The work that we currently, what we kind of started as, is that really work in providing best practice guides for public officials and other kind of folks who are trying to get good policy in place for environmental management, or being more sustainable, or what have you, a wide variety of topics. We do workshops and trainings. We work with community members, community groups. We help people figure out how to talk about certain issues at the level of which the audience they're working with needs, right? Which varies dramatically depending on who you're talking to, right? So this work brings us into contact with so many different types of researchers in numerous fields who are interested in environmental impacts, conservation, protection, health, and justice. I came into the field through the world of brownfields. I'm a sociologist. My background is in social movements and political and feminist scholarship, and my dissertation was about the history of the Nazi Party in Munich from 1924 to 1929. Right?
Did they have any environmental exposures?
Yes, they did. Well, so this is a funny thing, right? So I come into this work, through this work, as working with an environmental economist who's studying brownfields, who understands that having a sociological understanding of social movements and social organization and social change impacts how land gets used, impacts how people understand and can come together to make decisions about land. So that's how it started. That's where we started to find those connections. So brownfields, in case folks don't know, are vacant and abandoned and underutilized properties that have real or perceived contamination that have hindered the redevelopment of those properties or the full use of those properties. And the really crazy part of that definition is that real or perceived contamination. it drives everybody nutty, right, in terms of that definition. So it's not really, the federal program around brownfields is not really about environmental cleanup, it's about economic redevelopment. Safe economic redevelopment. So anyway, as I said, the work has, this work has really centered on helping folks understand the complexities of these types of properties, and so that everyone who's interested, who has a stake in the outcomes of these properties, can engage in decision making about it in a really substantive manner. Most times the properties in questions have only light contamination, or the contamination is really easily managed. And so helping folks get over that hump, helping bankers, lenders understand and reduce the fear of the stigma of the property, helping community members understand that, yeah, it might be kind of ugly, but let's figure out, here's how we find out how ugly it is and how scared you should be. Or you don't have to be really scared. It's not that bad. And here's how you manage the minimal exposures that might be there. So helping folks understand the risks involved in redeveloping these properties is another place that where I come to the table for this kind of work.
Is it small enough that I can ask a question?
You know, you can. Please.
Sorry.
No, please don't apologize.
What's the most likely way that issues come to you? Is it any time land gets sold, or does there have to be an environmental study demonstrated? How do things end up in your lab?
So as somebody who runs a policy center, I apply for grants that are sent. My funding, my core funding comes from the EPA, and so people will come to me and ask, and that core funding is for technical assistance to community members, to folks. They don't really have a limit on who I'm allowed to provide technical assistance.
So how do you find those?
So I have a website, and I go to conferences, and I have other relationships with municipal folks across the country, and they ask me questions, or they know that I know about brownfield redevelopment. They know I know about how to get community members to engage in that process, or they know I know about integrating equity into environmental policy making. So I know about those kinds of things. So they ask me to come talk to them, or they ask me to they review a policy or something like that.
She knows lots of attorneys too. So there you know, there's a lot of environmental stuff that we never hear about that attorneys know about.
So in the environmental justice world, and okay, so the story of meeting Matt, for instance, is a really wonderful story. I walked into that project through a grant from when I started this work that was from the EPA to increase community engagement in brownfields redevelopment in socioeconomically disadvantaged communities. So I was focusing on the Park Hill corridor here in Louisville, Kentucky, and our job was to help folks come to the table to understand city programs around brownfields redevelopment, what brownfields really are, what risks are, what the state programs are, what their role in all of that could be, what community organizations can do, what they can advocate for, how bad is if you've got a measure of lead of this level in your soil, is it safe to garden in that? A whole host of different kinds of questions. We ran that program for about 5 or 6 years, building a community of stakeholders, both residential and businesses, because it's a former industrial corridor. Adjacent to that corridor is the 18th Street corridor, which is a commercial corridor that has really been devastated. Lots of disinvestment, lots of abandoned gas underground storage tanks, things like that. And On this street, there was this site called that once housed the Blackley Chemical Company that made pesticides there. And during the process of bringing folks together along the 18th Street corridor to talk about the revitalization of that corridor, it so happened that the state and the EPA discovered that this Blackley chemical site still had lots of really bad chemicals sitting on it, and it had migrated onto the residents' properties that were adjacent. Very dense residential area right up next to this very large site.
Where you made, I think we have a poster up on this, so they all have NASH. Everybody that lives around the site, I think it's 80% prevalence or maybe higher, which is why I got involved with it.
And so we run into the problem when we're talking to communities about this, when I'm working with them through the EPA and working with them about soil testing and soil safety and can you garden on this safely or not. They say, excuse me, why isn't anybody testing the humans? EPA is here sampling my soil, they're cleaning out my soil, but they're not doing anything about my kids in the neighborhood. Nobody's taking the blood, looking at my kids' blood. Nobody's looking at my grandmother who is about to die of cancer. Nobody's looking at all of that. Nobody cares about the people. And so then when we had a really awful experience of having folks from ASTDR and some other folks come to the table to try to explain to the community that all the soil is contaminated everywhere, and so you just don't dig in the garden and just don't worry about it. Really, is what they kind of said to folks. Well, then Matt came to the table with his research, and he heard about all of this, and he proposed to do some sampling, and got some money to do some sampling and some limited testing. And so we're still at the point, we haven't touched base recently, but in the last few months, but still at the point of actually being able to test for some of the things that, and do maybe a broader sampling of what he has been able to collect to build on that repository. So our work with Matt involved helping him recruit folks, but also helping him deal with the fact that this population, and a lot of folks in this neighborhood felt overstudied. There are folks at U of L who had done research here and have not given them the results back. And so we had to help them manage a little bit of trust in that, and help get some of that to the table, but also help manage a little bit around, there is a different kind of, the individuals want one kind of data. They want information so that they can either go to their doctor and get it fixed, or they can sue.
So,
right?
Matt, what kind of samples would you need for a site?
Well, we were just trying to collect blood samples, and there were a lot of unanticipated pitfalls along the way. For me, that's why I asked Lauren to come. Like, for example, I'm an adult hepatologist, so I wanted adult samples. Well,
So do you need livers to diagnose NASH, or do you just need...
Well,
so what do you...
it's best if you have tissue, but we have some serologic biomarkers that we can do now too.
Cycler 18.
Right. Yeah, that's what we've been using.
So if we had a site that was perfect and a small town...
There's some good sites in Arizona if you were thinking of any specific. Yeah, there's some highly arsenic contaminated areas there. So I'd love to work on that. But it'd be important. I've learned through limited experience that it's important to work with someone like Lauren, who knows a little bit more about environmental justice and the social aspect of things, to help identify problems before they happen, and to communicate the results to people. Just an example on this limited small blackweed project, we had a subject that only one subject tested positive for high arsenic levels, and that call from a newspaper reporter that had heard the rumor and wanted to know all about the subject. And I said, well, I can't disclose that. This is protected health information. And I was basically told, you know, that we may not get the most flattering press because of this. And the next day, the subject was in the newspaper, on the front page of the newspaper, with an American flag and arsenic behind it. And the reporter had actually gone door to door in the neighborhood asking around until they identified the person who identified themselves. And so that was kind of a shock to me, and you know, just issues of dealing with the media. You know, I'm not accustomed to doing it, so the center was a big help to me in learning how to manage this, because you can never do enough, and people tend to get angry, even if the anger is misdirected towards someone that may be trying to help them, just because they're the only person that they can yell at.
Yeah, you have to have a really strong, thick skin beyond what you normally would expect, especially if you're walking into a community that has experienced historical and deep disenfranchisement and other kinds of discrimination over the years. So your position of privilege, your position of authority as a researcher, as a medical professional, is going to be a target for that. And you kind of have to get over that and know that any of that anger is not really about you. It's got nothing to do with you. It's about the position that you hold and the treatment that folks have experienced over the years. But it's also about the kind of growing distrust at all sorts of different levels about research in general that we've experienced. You know, we see it from all different areas. I mean, I'm a sociologist and I see it. You know, nobody trusts a sociologist. We're because we're communist social engineers, right?
Right.
You know, I mean, right? You know, that's my job, right? And so it becomes it becomes really important to, if you're going to do that kind of work, and if you're going to, to understand the benefits to you for building something over time. So, you know, conversations with Matt and with others involve saying, look, even if you get negative results, even if you get something that's not, you know, publishable, or that's not going to be, you know, the big opener for solving the problem, talk to the community about that anyway, because they'll get it. And you start building a relationship and building a way of a system of trust, right? And a trusting relationship with folks that then can come back to you later on. That when you get that next piece of funding, if you don't, you know, so one of the pieces of frustrations in this is we didn't have enough money or time to actually go up to actually test children at this point. And that's where folks are really worried about. They're really worried about their kids, right? So they didn't get about, you know, some of the others, you know, the initial results. Well, why did you test the kids? So Matt had to bear the brunt of that, understanding that, and try to let folks deal with the fact that, you know, we got to get more money to the table to do this, right? We've got to have more public commitment to it. You know, there is a ton of money out there to test the soil, right, comparatively. There are programs out there to help folks test the soil. There are programs that there is a public desire and an economic benefit to test and clean up soil and bring brownfields back into economic production, right? There is not a whole lot of public commitment to testing the environmental impacts of peanuts. There's not a lot. You have to really dig for that kind of support, especially the kind of data that you need. Like your question for Matt, what kind of sample did you get, right? Your funders aren't interested necessarily unless you have the right sample size, right? Or have the right way of building that over time. You have a difficult time making that argument to get that kind of research funded. And so there is a role of advocacy for, or a place where communities can help you get those resources to the table. If you start building that relationship of trust, they can start. They'll surprise you to death and start advocating for that kind of money to come in to do this kind of research. You know, we had it for lead for a while, right? We had we still have a lot of states, kids are tested for lead, you know, but it's a part of your normal pediatric checkup. But that's it, really. We don't have much more than that. And lead is just a huge problem everywhere, and not just for little guys.
State health lab.
Hmm?
Can you cross over with the state health lab? Do you have a state health lab that does all of this testing on time?
So there are state health labs, but they are not, you know, I'm not familiar with how they actually work
We have a
with
community health department.
a community health department. They don't, the community health department, one of the interesting and frustrating pieces of this particular project is they came to the table to one of our meetings and they said, oh, well, we'll at least do lead testing for kids. Anybody who comes to the table and, you know, wants to have their kids tested, we'll do that. Well, the guy spoke out of turn. His boss came down on him and said, you never said that. You didn't say that. We didn't say that. We're not going to do that. Because the CDC is no longer funding local public health departments to do it. They don't have the money to do it. And so they'll screen them, which means they'll go to, if the pediatrician reports something, then the health department will have that record in there somewhere, because pediatricians have to report that in. And so you can find out if your kid's screened high in there at that point, but they're not going to pay. Right? So that was some of the, you know, so figuring out those, helping researchers figure out where the barriers to getting their work done have been, and how to help them get around those is part of the work that we do. And the other piece of this that Matt mentioned was the legal story here, right? So folks want to have their blood tested to make sure they're healthy, or to figure out what to do if they need to go to the doctor. Is there something you can do about it? You should always have. I was really happy to hear that there, I guess it's mostly in the clinical side, where you have an intent to treat written into your projects or not. So figuring out whether or not you're going to be following up with folks or not, if you find something bad, how are you, if you're not providing the treatment, do you have a way of referral that's concrete for those folks? A little bit easier now that we have a little bit more widespread healthcare system. It's harder to really do that when a lot of folks did not have health insurance or access to any kind of primary care physician. So I wanted to, look, I'll finish the legal part of this. So the folks really want to know whether or not they can get remedy. They want to know if they can get their bodies fixed, but they also want to know, can I go after the folks who caused this problem? Can I sue the responsible parties? Is there an individual response, or is there a class action? Or is there an opportunity for class action? And so when you've got a population that has been systematically treated terribly, that has been when you've got uneven distribution of environmental harm that they've experienced, you're going to have a lot of folks wanting to know who can I hold responsible for it? It's this weird, you know, unnameable. They can't put their hands around it, and they get really. These meetings are heated, right? And so they don't know if they're holding Matt responsible, or if they're holding, if I've got city folks at the table, if they're responsible. Is Public Works responsible? Is the state Department of Environmental Protection responsible, who should have actually dealt with the site back in the 80s when they actually did find contamination on it and then didn't do any further testing? Or is it the EPA or the Corps office that dropped the ball? Is it the EPA headquarters that dropped the ball? Who is it? Is it the companies that poured the pesticides in the ground? Right? Who is it? How can they hold that? How can they be held responsible? So they have to explaining to them what that legal procedure is is frustrating because they are absent from the decision-making process. They're absent from the remedy. The state's making all the decisions right now with responsible parties. They're figuring out the cleanup plan. They're figuring out how much money it's going to cost. They're going to figure out who's going to pay for it. They're going to make the decision about how clean that property is going to be made. And that will determine what can then go on the property. So if they only clean it to industrial standards, guess what those homeowners are going to have right next to them again? Something industrial. Do they want that or not? So my job, one of the things I do is try to help them figure out where can they have a voice in this decision. Well, they also have to understand some of the other highly technical pieces of it in order to have that voice. And I work to, and it's such hard work, I'm not there in any way, shape, or form to try to help them do it in a way that they don't end up looking stupid, or they don't, because they're not stupid. These folks are really smart. They know, they can understand so much more than folks give them credit for. And it's about how you communicate with folks to allow them to participate in a real substantial way so that they can help folks get to a better result. We could get to a better environmental result if we have their engagement. We can help them figure out how to pressure the right folks to get the higher standard of cleanup for that site, and thus have a better result, probably economically for the city as well in the end, right? So it's figuring out how to make all those things work is the fun that I get to have. It is a lot of fun, and it can be very frustrating as well. And I see it as a long-term process, a long-term investment, a long-term partnership that comes and goes. I mean, it's not, Matt and I, we've seen each other maybe 3 times over the last year, maybe? Is that about right? If that? Yeah. But I feel like we've been able to, in those times, and the way we've been working together, we've been able to figure out opportunities for helping each other out, to figure out where those next steps are. And you start building those things. So this repository is something that's going to be really important for folks to continue to build on. And if I know about that, he knows about that, the community knows about that, then we can start helping build a better research project and better results, but also get better results for the community. And sort of fix some of the relationships with U of L that have been damaged over the years, right? So that's one thing. I did want to say, I don't know what time it is right now. I don't want to, because I can talk about a lot of it for a long time.
See if you can wrap
But
up
a
in the
couple
next.
minutes. I want to say that coming in here today has been it was a little scary. But I'm kind of proud of myself because I understood a lot of what was going on. But I also think that the work that you're doing is so incredibly important, and the audiences that you bring your research to, they need this. So individuals need it in order to make better health decisions, right? They need it in order to decide what they're, we heard mostly about diet and drug impacts today, and genetic impact, and disentangling all of those things, right? I got that right? Okay. And so I was really also very heartened and excited to hear that taking that kind of information can actually, learning from how the liver functions work in that way can be used to understand the other environmental toxic processes as well, and so that you're not starting from ground zero on all of that. And so unfortunately I can't stay for the afternoon, or I think you're going to be talking about a lot more in that regard. But that is really important. People, these populations who have been disenfranchised in this area, they are constantly blamed for their condition. It's their bad diet, right? That's what it is. It's their bad diet. They smoke too much. They don't know any better. They're educated. They don't know how to eat right. Right? This is constantly. This is what's being thrown at them all the time, and so they're constantly feeling like that nobody's taking responsibility for the other things that are causing these problems. Well, yeah, bad diet is a problem, right? And no exercise is a problem. All of those things are true, but these other things, the co-commitment and the other kinds of environmental impacts that interact with these things, it's really important for them to understand how that there are folks doing this work out there, because they don't see it. The public doesn't think that there are folks that are out there doing this. They don't think that and they know that there's a dearth of information that can find that smoking gun for drawing that link from environmental pollution to human health outcomes. And so I'm really excited about their liver research. So I really want to help you guys. I want you all to think through how you communicate this in ways that are useful to a variety of audiences, not just the community members, but the policymakers. I did hear somebody saying, I don't want to get political in here. But you're working for the folks you're working for pharmaceutical companies. They want to do well with the drugs. They want the drugs to work, right? Well, there's a lot of other places that's political in and of itself, right? So it's not about not getting political or not getting political in the end. It's about being able to communicate your research to the folks who really want it to be able to make better decisions. So I'm thrilled. I was, all you guys.
Thank you. I guess before we wrap up,
So
are you able to provide a quick consultation to people in the audience that might have a particular question, even if they're outside of Louisville or Kentucky or even EPA region 4?
Oh, absolutely. Anybody can get in touch with us about that. I do.
And they've got a great website, probably the best website at the university on that. Is it CEPM?
Mm-hmm.
Center for
Louisville.edu/CEPM.